Your CNOS Health Watch on Siouxland News.
Hip replacements aren't a new surgery, but different techniques could have some people confused about which is best. Siouxland News reporter Katie Link went to CNOS to find out more.
One of the questions I've been asked increasingly frequently over the last 6 to 12 months is, can I have my hip done through an anterior approach?
Dr. Steve Meyer is an orthopedic surgeon at CNOS. He says the anterior approach to hip replacement is not typically the norm.
Probably 95% of the hips have been done through what we call a lateral or a posterior approach.
Some studies have shown a quicker recovery and a smaller incision for the anterior approach.
We do have one surgeon here at CNOS, Dr. Dan Nelson, who is trained in anterior hips. I am currently undergoing training to do those in case there are people who feel very strongly that they want that procedure done. So we can do those procedures here in Sioux City.
But there have been improvements on the other side too.
Is that the posterior exposure through what we call a minimally invasive approach, which is a technique that several of us at CNOS use, where you make a very small incision, do less tissue dissection, etc., that the newer posterior approach is actually better than the anterior approach, both for postoperative pain during the first 6 weeks and for the appearance and complications of the wounds.
So which one is actually better?
There's conflicting data. The thing that's not conflicting is that at 6 months, every study that I've looked at has shown that the results are equivalent.
Talking with your surgeon to find out their technique and preference might help you make up your mind.
It doesn't really matter. What really does matter is going to a surgeon who has a lot of experience and appropriate training, because what we've seen, the data does show very clearly that your long-term results are obviously what's important, and what really affects the long-term results of a hip or a knee replacement for that matter is the experience and training of your surgeon.
For Siouxland News, I'm Katie Link.